Let's check if Congresswoman Angelina Helen Tan is on board already. There she goes, Congresswoman Angelina Helen Tan, Chairperson of the House Committee on Health. Congresswoman, alam ko na rin naman yung dahilan, pero mabuti na yung I give you the opportunity to explain yourself kasi mukhang nabatikos ka last week. Some people had the impression that you jumped the line. And of course, kasi congresswoman, attitude came into the picture. What exactly happened there? How did you get vaccinated at the Veterans Memorial Medical Center?
Good morning first, sir. Sa inyo po mga televiewers, good morning po. Thank you for the opportunity, although sana tapos na the issue. What happened, sir? Kasi as you mentioned earlier, my son is a surgeon in VMMC, and he mentioned to me they were asked to register family members, 3 family members, and he asked me Monday night, naka-register kayo ni dad and one of my sons sa veterans if you want to avail. And then ako nag-isip pa, and then morning ng Tuesday, naisip ko, since uuwi na ako ng probinsya, I texted him. Sabi ko, is it okay to avail na the dependents? Kasi syempre iniisip ko din yon. But more than anything else, ang intention ko talaga, sir, because of that negative connotation on Sinovac, and that's the only vaccine that we have last week, no? Sabi ko, baka it would help if I get vaccinated, not as a congresswoman, but as a doctor also, no? Na mag-avail ako. And then, second siguro, as a congresswoman, hindi isipin ng mga tao na may special treatment sa mga legislators. They're getting the most popular brand, no? Napaka-genuine po ng aking intention. And nagulat ako kasi naging issue sa iba, no? I don't think, parang meron lang talagang gumawa po ng issue doon sa pagpapabakuna ko. But when I asked naman my son, very clear, and he even sent to me a memo na sa mga empleyado na iparehistro yung pamilya. So, yun actually, sir.
Okay, well, I actually expected that answer, Congresswoman, kasi nga, I think a lot of people forgot the fact that you are a physician as well. May nagtatanong lang, under this setup, are you categorized as a frontline health worker? Kasi nagiging parang parang nasagot mo na doktor ka pero hihirit pa yung iba. Doktor ka nga pero hindi ka naman frontline worker. Ano ba ang sagot mo doon?
Medyo confusing yun, sir, to others, no? Kasi syempre, ang kino-consider nila na frontline health workers are those who are actively working in the health facilities and in the community. And we know that I'm a congresswoman, but I'm a doctor first before I became a congresswoman, which is something na hindi maaalis sa akin. In one of the interviews I mentioned, actually in the district or in Quezon, hindi po ako nakikita ng mga tao as a congresswoman. They call me as doktora, no? So ang tawag po nila sa akin doktora, and whenever I'm in the district talaga, I function more as a doctor. Sorry to say that, no? But you know naman the clamor of the people, 'di ba, sir? Kahit congresswoman ka, pag pumunta ka sa barangay, dadating sila at nandyan sila lahat nakapila because they're expecting me to check on their health, no? So parang ako siguro, sir, nakalimutan ko din na congresswoman ako. But I'm more of a doctor. So ang sa akin, ang reason ko, kaya ako din in-avail yun, because I'm also a doctor, no? So, kino-consider ko, sir, ang sarili ko as a frontliners kasi every week yan yung aking, hindi nawala po sa aking sarili yung pagiging doctor. Although I'm not working actively or in a private practice in the hospital, I also go to the hospital because before I became a congresswoman, I work in the hospital actively, no? So, siguro medyo na-confuse yung iba dahil nga then congresswoman ako and nakita nila siguro sa Congress lang ang ginagawa ko, hindi ako nagpa-practice as a doctor. But I do practice free, no? Public servicer. So, yun
Okay.
medyo nagkaroon ng confusion.
Congresswoman, total, we are clarifying confusions already. Can you clarify for me, no, para sa akin lang? Kasi may nagsabi sa akin noon na may hospital ka or may-ari ka ng hospital. Is this correct?
I used to be the medical director of the hospital, which I initiated. It's a corporation, sir. So, hindi naman ako talaga yung majority na may-ari po ng hospital. I'm one of the shareholders of this hospital, the family, no. But I was the one who initiated this hospital. Yes po. So,
So in that regard, you can also get vaccinated because you are a stockholder of the doktor ka na, stockholder ka pa, tapos head ka pa ng Committee on Health. Ito meron lang request dito, can we clarify, was the vaccine made available because she's a doctor or because she's a dependent of her son? Actually, yun din ang liliwanagin ko sana, the Congresswoman, no? Kasi for purposes of transparency, I've heard of so many companies, no, and I myself, may lumapit na sa akin na isang sa church, no, sabi, Cito, qualified ka kasi nagpi-preach ka na, etc. Baka doon sa church nyo may vaccination program, because I've heard of other churches, companies, na they're not only going to extend to their employees, but also to the immediate family of the employees. Now, mukhang, I think God works in mysterious ways. And ginamit ka siguro para ma-address na itong mga problema na ito. Because, you got it because you are the dependent of a physician.
Yes, sir.
Okay. That is based on what concept? Kasi sa private company, sinasabi nila, private company, they can do what they want. With the government hospital, ano yung basis ng extending this to dependents?
That I do not know, sir, no? Kasi when I was informed by my son, nagulat din ako na meron silang privilege, no? Nung sinabi niya sa akin. And I even asked him the memo, no? So ako naman, I thought that was clear in the government, no, sa ating mga namumuno sa gobyerno, na merong ganyang polisiya po ang mga hospital and even other government hospital. Is just siguro, sir, na sensationalization sa akin because I'm a congresswoman, no?
Yeah.
But prior to me, sir, there were dependents of health workers who were vaccinated. Ako naman, I don't wanna question that policy. I guess that's one way of appreciating the sacrifices that our frontliners had been experiencing for the past year, no? So parang para sa akin, sir, first linawin ko ha. Una, I'll be very honest ha. Magiging tapat po ako sa inyo. When I went to veterans, it's because I'm a mother of my son who's a doctor.
Okay.
Second on my consideration is, nung nag-isip ako before going there is, I'm also qualified because I'm a doctor and I work in the ground.
Correct.
Okay? So, and then third is, I want to set an example na no BIT on this one. Hindi ako nag-jump sa line, sir. Naka-register po ako sa veterans as a mother of my son and as a doctor siguro. Kaya nag-yes sila because alam nila na I'm also a doctor. When they said yes. So, hindi lang po sa veterans, I think, nangyayari yon. I ask other friends, no, who's in other government hospital, if they were asked to register a family member, and they said yes. So some governments, and it was approved by the National Vaccination Committee.
Yeah, but I think the spirit or the intention is ano ang saysay? Bakunahan ko yung doktor. Pag umuwi naman siya, hindi bakunado yung pamilya niya o yung magulang niya, mamamatay din yung mga magulang niya because the highest exposure are the frontliners, and we need to, and I'm not justifying for you or excusing you, no. I heard this discussion kasi recently regarding teachers and students and parents, and someone pointed out to me, Cito, what is the point of vaccinating one set of family members but not vaccinating the others? Mababakunahan mo nga yung workers, pag uwi naman sa bahay, yung mga lola, nanay, tatay, walang bakuna, di patay din sila. So it's
Yes.
it's a zero-sum game.
Sir, tama po kayo. That's my last point, no?
Sorry.
Yes po. So, napakalinaw naman ng paliwanag po ninyo, no? Kung vaccinated ang isang, like the healthcare workers and other family members ay hindi naman. So, siguro lang, sir, in a community, hindi ba, tumatarget tayo? Or in the Philippines, they said we need to vaccinated at least 80% or 70% of the population. Pareho lang yon. In a household, we wanted everyone get vaccinated, 'di ba? Sa isang tahanan. So, where do we start? Siyempre, sa lahat ng bagay, nagsisimula tayo sa tahanan bago pa tayo makalabas sa barangay or within the city, hindi po ba? So, I think that's where they're coming from, no? So, kung etong mga lahat ng, if you have like 50,000 healthcare workers, and we extend it to the family members, we like parang times 3 kaagad yon, and yung coverage natin ng protection mas lumalawak.
Okay, now next question ko, Congresswoman, may naging side effects ba? Kasi we are all promoting vaccination. Ako nga lang, medyo tanggal ako sa listahan dahil senior citizen daw eh. Pero sabi ko, hindi naman ako mukhang senior ah. In any case,
You're in the next group na, sir.
Sabi, the question is, may side effects ba sa'yo? Because we want to promote vaccination.
As for me, honestly speaking, sir, wala pa ako naramdaman na any side effect. No? Even immediately after the inoculation, wala akong pain, walang heaviness on my right shoulder. And then yung expectation na baka lalagnatin, sasakit ang ulo, wala po akong naramdaman. So, for the past 7 days, wala po. As in, walang symptoms ako naramdaman.
Okay, now itong next topic naman, itong creation of the Philippine Center for Disease Control, no? Kasi may mga nagsabi dapat disease prevention and control. Sabi ko, yung disease prevention sa DOH yun eh, yung disease control dito sa bago. What are your inputs on this subject?
So, sir, after, eto nga, with this experience ng pandemic, nakita natin yung how weak the health system, no? We do have the existing mga divisions within DOH, like ang naging problem natin, surveillance, di ba, sir, in the Epidemiology Bureau, the data reporting or data collection. So, ang daming naging problema. And until now, I think we do have a problem. So, we wanted to create one center that will focus more on the prevention, no? This is control and prevention, whether it's a communicable or a non-communicable diseases. So we're not only targeting yung mga infectious diseases, but I guess the goal here is that we'll have a good system on data collection. So basically, magkaroon na tayo ng profiling of the health of the Filipinos. So when a pandemic comes or epidemic or an outbreak, ready tayo lahat. So we will strengthen. So isasubsume natin, sir, yung existing division ng DOH, the Epidemiology Bureau, RITM, sir. Alam naman natin yung RITM, nag-iisang reference laboratory natin. And then the International Health Surveillance of the Bureau of Quarantine,
Mhm.
and Disease Prevention and Control Bureau of the DOH and the AIDS Laboratory po, yung STD AIDS Laboratory natin. So
Okay,
ito
what
yung
what
ilalagay natin sa CDC.
what about the Philippine Genome Center? Kasi I don't know if you cannot put them together, no? But I was just wondering bakit hindi sila kasali dyan sa CDC.
Sir, hindi namin to kasama kasi yung genome is under the UP system. Ang
Mm.
CDC po kasi is restructuring within the Department of Health and creating a center independent, no, magiging technical advisory body siya ng Department of Health.
But
We are creating at the same time virology center. Sir, so that's another center, sir, which we think baka doon fit po yung genome. So we're exploring. Tomorrow we'll have a hearing on that. So
Yeah,
kailangan
because
magkaroon ng delineation, sir.
oh, kasi ang worry ko lang, Congresswoman, and I'm sure you're aware of this already, that under the UP system, the UP system is already poorly funded. Tapos marami pang social services ang UP system because of PGH, the Genome Center. And it is not a surprise na maubusan ng supplies yung Genome Center. So either you make them an extended or a ano ba yung tawag nun, parang extension office, allied service or whatever, no, para lang wag nga. Pero is everything on the move as far as putting up the Center for Disease Control?
Yes, sir. Last week, sir, nagkaroon na po kami ng hearing sa Committee on Health and we approved the substitute bill, no? And we asked the DOH po to discuss it within the department before po kami nag-hearing kasi I'm sure merong mga reservation others, no, yung other high-ranking officials within the Department of Health. So I asked them to conduct a stakeholders forum and present it to the Committee on Health. And luckily naman, nakakam up sila ng substitute bill and we discussed it together with the members of the Committee on Health and we approved it, no. So medyo magandang naging kinalabasan, sir, kasi nagkaroon na nilist na nila ano yung mga functions of this division and ano lang ang pwedeng i-let go nila and explain nila bakit. Like for example, sir, in my proposal, I was proposing the Health Emergency Management Bureau or HEMB of the DOH to be included in the CDC. And maganda po yung justification nila na hindi siya isama to subsume under the CDC and sinabi nila it will become as the operation center. So to operationalize all the researches, the policies, the standards, nandito sa DOH po yung HEMB. So I think it's just a matter of time, work on progress, sir.
Okay.
In the Congress.
Okay, personal agenda. Obviously, ano? Personal agenda, Congresswoman. I have been asking around, but I can't seem to get a straight answer from anybody. Since COVID-19 hit the Philippines, everyone agrees that our biggest concern will always be available hospitals and facilities to address this. Now, ang sinabi ko, imbis na tayo build, siguro nag-focus tayo dapat sa build hospitals. And I have been asking, meron bang natayong kahit isang bagong malaking public hospital sa Pilipinas? Because I noticed, parang kinalat sa mga barangay yung primary care, health center, and then meron lang secondary hospital, konti yung tertiary reference hospitals. And sabi ko, yung heart center, pataas na ng pataas kasi walang loteng paglagyan, etc. And kawawa yung mga nasa probinsya, sa regional areas na we are not investing. Given the reality of this pandemic, you would think that there would be more hospitals that were put up in the last year. could you share your knowledge on this matter with us as a doctor and as a congresswoman?
Yes, sir. As the chair of the Committee on Health last Congress, we passed actually around mga 22 now enacted but unfunded. That is establishment and upgrading of hospitals, no?
Mhm.
So yan po ay sa iba't ibang parte ng ating bansa. Ang nakakalungkot nga, sir, siguro, tama po kayo doon on prioritization pagdating po doon sa funding. Napakalaking problema po natin. And tama din po yung observation nyo on build, build, build na sana nabigyan ng pansin doon sa build, build, build yung hospitals, hindi lang bridges, hindi lang roads, and other buildings, no? So nagkulang tayo sir doon, no? Honestly speaking. Okay sana po din naman yung primary healthcare, no, to strengthen kasi ito yung pinaka-accessible sa mga tao, and na-strengthen natin yung service delivery network, which is the referral system. Unfortunately, sir, even if we have like mga district hospitals, alam naman natin na napakalaki po ng kakulangan ng mga pasilidad, hindi lang sa equipments, but even in human health workforce, no? So, hindi lang siya construction sir but even the health human workforce and the system itself. Kasi kung meron kang magandang sistema, kahit na may kulang at maayos ang referral natin papunta sa isang facilities, I think pagdating nitong pandemic na ito, medyo may kakaiba sana tayong positibo na nangyari sa atin, no? So, honestly speaking, sir, yan yung kinaka-frustrate ko as a health advocate, no? Whenever I see funds na sobrang nagbo-bloat in other agencies, and nakikita ko doon sa Department of Health, sir, yung HFEP, which is infrastructure po yun and equipments, ay napakaliit ng budget. And there was a time, I think last year in 2019, tinanggalan po nila yan ng construction. So tama po yung sinabi nyo, wala pong bagong hospital like yung PGH or heart center. Kung nakapaglagay ba tayo ng isang
New hospital
outside Manila, like regional hospital na meron pong heart center. SPMC, sir, I think they have in
Southern Philippines, in Davao.
Yes, in Davao. And I think in Vicente Soto, sir.
Pero mas matanda pa sa akin yung Vicente Soto Hospital na yun eh. So it's not new. In any case,
I think it's expansion of the services lang. So they can now cater mga angioplasty in that facility, angiogram, bypass, but hindi po siya balanse, no? So ang dami pa pong hindi talaga nakaka-access.
Okay, I think we will have to schedule you again, Congresswoman Tan, para mapag-usapan natin itong anomaly, so we can discuss this anomaly in our health system where poor patients need to go to congressmen, mayors, get letters of guarantee and allocation, and to be treated in hospitals in Metro Manila. Gagaling ng probinsya, hihingi ng tulong sa congressman o sa politiko, and then pupunta sa Manila. We hope you can give us that time in the coming future, and thank you for your time this morning, Congresswoman.
Thank you, Sir Cito, for the opportunity. Anytime po, yes, we'll schedule. Looking forward po. It's a good discussion po yung issue na yan.
Okay, maraming salamat, and that is Congresswoman Angelina Helen Tan. She is the chairperson on the Committee on Health of the Congress.